Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Radiological investigations and certain thumb signs and the certain thumb rules or the very important rules. So first is X-ray. So talk about X-ray. X-ray is the initial investigation for the emergency. Initial investigation for the emergency, example is a pneumoperitoneum. So there is initial investigation of the emergency, that is the pneumoperitoneum, as well as the intestinal obstruction. The next will be the initial investigation for the fractures, as well as initial investigation for the foreign bodies. Then the initial investigation for the tumors of the bone. Then it's the IOC, investigation of choice, to know the position of the medical devices. Example, the position of the ETA, as well as the central line. To know the position of the central line as well as the nasogastric tube. Now let's move on to the CT. So here in CT there are many varieties. So under CT there is something known as a hyperdense CT. Hyperdense CT is done for the bone cortex. So this is for the bone cortex, as well as it is done for the calcification. There is the IV contrast as well as the iodinated contrast. There is the active hemorrhage. There will be the HRCT. The HRCT is a lung parenchyma pathology, that is there is a bronchiostasis, bronchiectasis, as well as the presence of the ILD. The bones it includes, there is a temporal and also the paranasal. So bones, there can be temporal as well as the paranasal sinuses. Now we look at what is NCCT. So under the NCCT, it is the non-contrast CT. So here the IOC will be the head, the spine, and also the acute SAH. So IOC for the intracranial, there is IOC also for the intracranial calcification, and IOC for the renal calculi. So IOC for the IOFB, that is the intraocular foreign body, IOC for the bone cortex as well. Next is the initial investigation in case of the stroke, that is to rule out the hemorrhage. Then we move on to the CECT. So under CECT, it is a solitary pulmonary nodule. It's solitary pulmonary nodule. There is lung tumors. That is exception being the Pancoast tumor. Pancoast is the exception. This is very important. There can be renal stones, renal tumors, as well as the pancreatic carcinoma. There is the liver tumors, the mediastinal masses, as well as the acute pancreatitis. Then comes the CT enterography. The CT enterography is a small bowel pathologies. So CT enterography is the small bowel pathologies, is the Crohn's disease, TB, as well as the dual energy CT. The dual energy CT, it includes the gout, urate, and the calculi. Now we're looking at the CT angiography, is the sequestration and the aortic dissection, the aortic aneurysm, as well as the pulmonary embolism as the mesenteric ischemia. Then moving on, we look at, so we saw the CT angiography. Then we move on to the IOC. In case of MRI, what is the IOC? So MRI, you have the brain spine tumors. Brain spine tumors are neurogenic lesions, Pancoast tumors, then the posterior mediastinal mass, the chronic SAH, that is SAH to the NCCT, the diffuse axonal injury, and this a WI, gradient MRI. The most sensitive investigation being for the ischemic stroke, that is MRI, the brain tumors, the spine tumors, infections, as well as the demyelinating disorders. Then we move on to the US, that is ultrasound. It is an investigation of choice for all emergencies, that is a pregnancy, all emergency pregnancies. Then there is a fluid appears. It appears on the USG, that is the anechoic. Then comes the presence of the gallstones, then the acute cholecystitis. There's a hydrated cyst as well. Then the minimal pleural pericardial effusion. Then comes the infantile hypertrophic pyloric stenosis. To learn and grow daily like this, please do subscribe.